Thank you for tuning in to watch our Singing for Health webinar. This event is brought to you by our Northwest Creative Health Associate, Elaine Ryan McNeil. To access other event recordings hosted by our regional team, please visit the NCCH YouTube channel and select our regional playlist. Now, without any further ado, let's pass over to Elaine.
I'm really pleased to welcome Loz and Ellie here with us today, who very kindly offered to share some of the work that they've been doing. So if I can just give you a quick introduction to both of you, if you could give me a quick introduction. So Loz.
Hi, my name's Loz Kaye. I'm director of the County Song Project. I'll say a little bit more about my background, but I bring together both being a choir leader and vocal practitioner, along with now working on some bigger strategic projects to do with singing.
Thanks, Loz. And Ellie?
Hello there, my name's Ellie. I work at Queen Square Medical Practice in Lancaster, and I work as research development nurse, but also wellbeing lead for the practice. And I'm very good at building connections and collaborations and with local community organisations to try and get creative health sort of on the map. So that's a key thing.
And you're doing a great job, Ellie. Thank you very much. So I'm just going to share a little bit of a presentation around evidence, but then I'm going to hand over to Loz and Ellie. So I'm just going to share my screen. Also, it would be really nice if you could share with us what the last live performance you went to. It doesn't have to be a choir, or you might have been involved in it. So yeah, it'd be really lovely to hear about your own experiences of live music. So yeah, what I wanted to share here was some of the evidence on Singing for Health. So these resources have come from the Singing for the Health website, and they have a fantastic page on all the latest research on Singing for Health. And also I've drawn this evidence from the Fancourt and Finn World Health Organization report that was launched last year, which is a fantastic resource that's proving the strong evidence out there for creative health and how the arts can really improve people's and have actual health benefits. So the first slide here, what we've got is singing can help to manage breathlessness for people with persistent symptoms following COVID-19. This report by Phillips was done with the English National Opera, and that was from 2022. We've also got how breathing and extension of exhalation helps to improve lung function for people with COPD. And then we've got a study that talks about how people with chronic pain have identified multiple benefits from participating in group singing. We have the obvious, which I think people tend to think that singing for the brain, singing for people with dementia, and there's great benefits there. We've also got it can help with people who have Broca's aphasia, and I actually had the pleasure of seeing a choir from Liverpool's brain charity, and it was just remarkable to kind of have a conversation or struggle to have a conversation with somebody, but then automatically, as soon as they're singing, it's like they just came alive and were able to find the words. And also there's evidence that recognises repeating words is great when they're sung rather than spoken. So that's a Fancourt and Finn report there. But it's not only the physical activity, but it's also the self-expression, which brings about a positive personal and social impact. And then there's also the well-being, and not to forget the singing mamas, who I think might be here in the room, which is great to have you here. But the mothers singing to babies is associated with fewer symptoms of postnatal depression. So it's really good for us. And we're going to learn a bit more now from Ellie about how we can make it happen, and how we can, from Loz, about how it's expanding to make it available for people in the Lancashire region. So I'm going to, sorry about that, I'm going to share Ellie's slides now.
So my name's Ellie. I work at Queen Square in a GP practice. I'm funded through the National Institute of Health Research, and I love to sing, and I love creativity and opportunities around bringing in more creativity in health and social care. So this project, I think anything we do is not done in isolation, we do it in collaboration. So a big part of this, I'm presenting today, but I'm presenting on behalf of lots of different people. Like any choir, and any our voice not just on their own, they're kind of in a choir of others. So I want to recognise Queen Square, who I work for, the Gregson Community and Arts Centre in Lancaster as well, and the NIHR as well too. So how did it all begin? Well, we have a health fest every year in Lancaster, and it's quite a big collaborative community event that takes place. And in July 2021, there's a creative arts practitioner group that kind of met for the first time. And within that group, it was looking at opportunities to how we can kind of work more creatively in health. And so about 7 people met together, and it was facilitated and held at the Gregson Centre in Lancaster. And within that group, it was looking at just like thinking of ideas and what we can do regards going forward. And I came away from that meeting as a bit of a seedbed for ideas, and thinking, right, I've got to think of ideas, what can we do? Because I was so excited by it, kind of sparked something inside. And I think with COVID, as it had been, it kind of, I'd seen the other side of that, how people were so isolated and sort of worried about kind of re-emerging again. So so what I did, I'd seen a tweet about creativity and health by the National Centre for Creative Health, as it turns out, about the benefits of singing and sort of pulmonary rehab. So as a consequence of that, I then thought, right, okay, one of our GPs was the clinical lead for the Morecambe Bay Respiratory Network across the whole of Morecambe Bay. And I spoke to him, I said, look, why don't we get our own choir going? It'd be amazing. He said, I've been trying to do that for ages. I said, right, okay, will you let me do it? And he said, yeah, do it. So I was thinking where we're going to get the funding from. So we had research capability funding we get because of our recruitment across Morecambe Bay was really good. So we had a potential pot of £20,000 we could have used. But in the meantime, an email came through one afternoon for a managed COVID recovery fund, pot of money nationally from the National Institute of Health Research. So I quickly phoned Rachel Eastham, who's a volunteer at the Gregson Centre, but also an academic at Lancaster University, and said, we could bid for this money. Anyway, quickly put something together, and we got £5,421 to do a bit of a 12-week pilot, we did it as. And we recruited people from Queen Square. We advertised it on social media. We sent texts out to people, which included all people with COPD, any sort of lung condition for those over 18, including people with long COVID as well. And then we sort of set a day for consulting daytime, what was comfortable for people to take part. We had about, I think altogether, it just talks about the benefits of singing for lung health. I think we all know so the benefits of singing for lung health, not only sort of from how the data sort of emerges, but also, you know, how it is qualitatively as well. As mentioned before, the key players, Fiona Kaye from the musical Breath, we had National Institute of Health Research for regards to funding, and the Asthma and Lung UK Singing for Lung Health too were part of it to try and help promote it as well. The clinical lead at the time was a GP for the Morecambe Bay Respiratory Network, who was a GP at Queen Square at the time. We had the Gregson Centre, the practice at Queen Square in Lancaster, and we also had funding as a choir moved along. We also got funding through the Population Health Investment Fund and also Lancashire District Community Voluntary Service Fund, which is currently how it's being funded at the moment. On the call today, I have to acknowledge is Charlie Brown as well. She's a choir lead that currently has been amazing in setting all this up and working really closely with those that are still continue to do the choir. So I want to really acknowledge Charlie and her continuing work to keep this going as well. So when we did this, we had in-person sessions. We set off by, because Omicron had peaked at the time, so we set off with doing sort of a couple of Zooms to look at COVID comfort measures, what people were happy turning up in the space. We got CO2 monitored, we did risk assessments, got lateral flows, and we also did a video walkthrough for people to know exactly where they'd be going, where the toilets were, how to access the space. We made it as accessible, and we reached out as much as we could do based on people's feedback as well. We wanted to nod back to the practice and to health as well, for people to feel comfortable as well showing up. So we had one of our nurses turned up at every session. They were funded to turn up for them sessions, but they enjoyed it so much. They end up, I think one of our nurses is now a respiratory nurse specialist. She still goes on a day off to support this choir, which is amazing. Alison Brown, she's called, she's great. So it gave that confidence. The nurse that turned up wasn't in uniform, had no name badge on, but these people knew who she was because of coming to the respiratory yearly sort of annual reviews. They knew exactly who she was, and it provided an opportunity for Q&A, any sort of questions they might have had regards to the breathing, or it was a really nice sort of nod to health, but without it being too overtly sort of health focused, really. We did the 12-week pilot from March to July 2022. And then we did some in-person activities. We sent out sort of some quite fun things before they came, and we sent out things each sort of every fortnight for what they might be quite comfortable with. So things like what makes your heart sing, what song makes your heart sing, selecting a choir name, which is called the Breath of Fresh Air Choir, that was chosen by the actual choir members themselves. And it built this sense of solidarity, of friendship and comfort and community, and the social aspect of actually turning up, having a cuppa and all that kind of was really nice to see. It built capacity. One of the creative arts from the very initial sort of humble beginnings for the Health Festival was Janet Swan, who had led Singing for Lung Health Choir in Bern for about 4 years, thankfully. And she was able to sort of have that capacity building with Charlie, before Charlie trained in the musical breath with Feeny Bridges. So it enabled that too, a sense of collaboration yet again. And we had the people turn it for a cup and a biscuit and stuff, so that helped. We're in the process of potentially looking at doing sort of further sort of dig deep into sort of people's sort of feedback, qualitative feedback. We had mainly people from Lancaster area, LA2, and then some people from Morecambe as well. The main thing was sort of asthma prevalence was the main sort of part of that from the 2 surveys we sent out. And age range is it shows there, the average being about 62, but we had some younger ones that were there as well. So the impacts we had from this was people's better breathing, a sense of relaxation, improved inhaler technique, knowledge about the out breath and posture, and relaxing was quite a big thing. They found it stimulating, it was fun, and they enjoyed it. It was community, it tackled some people. I mean, the people that were so frightened about re-emerging after COVID, they thought they were going to die if they left the house. So to hear them stories and that fear that they had, it was really kind of, I was so pleased we kind of managed to get this off the ground for people. It tackled sort of stigma and assumptions around sort of respiratory conditions, and it also helped to build people's confidence. So where are we now? We're sort of Charlie's continued to run the choir. We trained up through, not through the musical breath. We got additional funding through Population Health Investment Fund to train 3 more choir leaders through the Feeny Bridges and the musical breath, Charlie being one of them. And we've got one of our other members that trained up for that is in Morecambe, Beth DeLange, who is based at More Music, and she's got a Breath of Fresh Air choir running there. But Charlie mentioned to highlight this because it's really important. If anyone's looking at setting up a choir like this, it's really important that there's really core funding that's there to get this off the ground, to provide that sort of initial stability. What happens now is with the Breath of Fresh Air Choir in Lancaster, I mean, it's still reliant on having some additional sort of core funding to some degree, and Charlie might be able to shed some more light on that. But we do a pay-as-you-go, so people can now pay because they wanted to continue in the funded run out initially. So I think that's really important. And we offered some outdoor sessions as well as part of that. Pulmonary rehab, they now filter through direct from pulmonary rehab into the choir each week. And they wanted, the people that took part initially wanted weekly and much longer sessions. So that's what it's being delivered now by Charlie. And there's a few little references as well. Thank you for listening.
That's great, Ellie. Thank you so much. I think if it's okay with everyone, what we'll do is we'll have a discussion and take some questions after the 2 presentations. I hope that's okay. Loz, I'm going to have a go at sharing your slides. Here we go.
Okay. Good luck, internet. Good luck, internet. Yeah, fantastic. Hello everyone, and thank you, Elaine, also for the invitation today. It's really timely. As County of Song, we're thrilled to be launching the Lancashire Community Singing Map as part of Creativity and Wellbeing Week. So this presentation's a bit about the background to the creation of the community singing map, what we found, and actually some thoughts about what it opens up. So it's very much links on from what we've just heard about the health benefits, but also a question about, okay, well, what next, and how do we scale this work up? And that's the kind of discussion we've been having. So if we could just kind of go on to the next slide, I'll kind of introduce me. I'm Loz Kaye. My background is as a choir leader and vocal practitioner. I think we might have some people in from a couple of the choirs that I run today. So shout out to Hope Mill Community Choir in Ancoats, and shout out to Liverpool Rainbow Choir, the musical voice of Liverpool's LGBTQ community. So my background is as doing in terms of leading choirs and sessions, but also I've become very interested in what's the strategic role that we can play to help support this work grow and deepen. I think that's particularly grown through my time at More Music, leading community music charity in Morecambe's West End, and then through initiatives like the Lancashire City of Culture bid. So that's a little bit about me. I realised that actually I didn't have a slide to introduce Lancashire. Because it's quite possible that also some of you may not know more about it than what Victoria Wood has told you. But Lancashire's population was 1.26 million mid 2022. It's an area of 1,040 square. Well, there's population density is 1,040 people per square mile. Compare that to Manchester's density, which is well over 12,000 people per square mile. The size is 1,189 square miles, whereas Manchester is 45 square miles. And the whole Greater Manchester area is 493 square miles. So that geography and density is important for what I'm going to go on to talk about. And it comprises Lancashire County Council, 12 local authority areas, and 2 unitary authorities in Blackpool and Blackburn with Darwin. So going on to the next slide, the background to the work of creating a community singing map in Lancashire was some research that I undertook, supported by Preston's Encounter Festival during 2022. And perhaps like breath of fresh air, that the background to this was we did some research on the impact on COVID on grassroots singing in Lancashire. Our research covered well over 50 groups, including all of the local authority areas. Essentially, it was on the back of at that time where there was some real concern about the impact that COVID had had on the practice of singing, and particularly within community groups. And that also that we'd been through quite a traumatic time, I think, both in the fact that there have been months where we hadn't met as choirs, but also where there was, for the first time, a massive question mark about whether singing was a healthy activity at all. So one of the key issues that we found in the research that we did was that community groups reported reported needs for help with recruitment and retention. That over 84% of respondents to our research had members stop taking part due to the pandemic. Some had more than 11 members stop taking part. And when you bear in mind most of the groups that we found in the survey are between 20 and 40 members, that's a significant impact. 93%, over 93% of groups were looking to recruit. So kind of going on to the next slide, that the absolute kind of key thing that we saw was as a significant risk point was that over a quarter of groups reported they were actually so concerned about recruitment, they were concerned about their long-term viability. So if we're thinking about this within also a health initiative perspective, this is also this would be a significant damage to an important sector within our kind of cultural sector and our cultural landscape. So then the question was, well, what are we going to do? So one of the recommendations from the report was setting up a project, County of Song, which I'm happy to be leading, and I'm really so grateful for the support of Lancashire County Council in getting this off the ground and Arts Lancashire. And that we saw as mapping as part of a toolkit initiative. So creating a toolkit to aid recruitment and retention, and particularly looking as mapping as part of this. So the aim was to create a map that was going to make it easier to connect groups to a wider public and a wider public to connect to groups. This was particularly in the landscape of a lack of an integrated picture in the community singing world, which is very much based on individual initiatives. So through the back end of 2023 and into 2024, County of Song's undertaken research along with the Creative Health Associate for North West, Elaine. This has been supported by Arts Lancashire, pulling together existing data about community singing groups across Lancashire with a call out for further information. We were deliberately fuzzy about the boundaries of who considered themselves defined within singing groups, choirs, that the activity that we've mapped includes traditional classical setups, but also improvisation, nasheed, rap and beatboxing, gospel, and more. So I'll let the academics amongst you argue about the boundaries, but that's we allowed that to be led by the groups themselves. So what have we found to date? So going on to the next slide. I'm really pleased to be able to present some out-of-date information, because we've now got 119 groups and activities mapped across Lancashire. Which is, I think, really exciting, and it represents all local authority areas, urban, coastal and rural settings. And particularly, we've had an emphasis on highlighting health-related singing activities. In particular, we've mapped 15 groups specifically focusing on people with dementia and their carers and friends and family. And we have data on session times, contacts and genres. So yes, absolutely to be able to make it as easy for people as possible to find these groups. But already some interesting things are surfacing when you start looking at this as an overall data set. And I think this is going to be a set of data that's going to be really interesting for academics, for health sector as well. Most groups function outside of this, what one might call the subsidised arts sector, and buildings belonging to the subsidised arts sector. So, for example, 42 groups meet in churches. So when we're currently having a political debate about, for example, how grassroots music venues should be funded, I think this opens up a question about, well, what do you consider to be a grassroots music venue? Actually, Poulton Methodist Church is a really important grassroots music venue, which has, hosting multiple singing groups. But it's always also just as much interesting to say, well, what do we not have? So going on to the next. So yeah. That's an empty. Interesting.
That's an old. Sorry.
Okay.
I'll move on to that.
Okay, never mind. You have never. So yes, never. So what do we? Actually, that was beautifully illustrated there with a what do we not have and a picture of a gap. Yes. So so what's just as much interesting is to say, well, what don't we have? So that's to as so when you start looking at an image with and a map with gaps in it, it's also, I think it actually shows also the work that's still to be done. That also we're still looking into in terms of servicing more groups that are youth-based, and that also that are broadly representative of Lancashire's diverse communities. I mean, Lucy Wright writes in her wonderful tract about folk as a feminist issue. She says, just because things are not, the activity is not there, it doesn't mean it doesn't exist. The map is a terrific tool which challenges the idea that actually Lancashire is an area which actually has low arts engagement. What's actually happens is also once you start digging a bit deeper, there are many groups there who are perhaps off the digital map, that don't engage particularly digitally, or actually not at all. So it's been good to surface that. So in lots of ways, the project isn't any more complicated than being a visualization of a list, and that but it depends upon the point of view that you take. The point that we've come to, that's say County of Song, and also working with professionals like Elaine, is that it's not just a recruitment tool. The Lancashire community singing map surfaces a rooted community infrastructure. Lancashire has some particular challenges when it comes to the music sector. We don't have musical beacon institutions and the buildings associated with them, the Halles, the Musikhuses, or the Elbphilharmonias, in the same way that Europeans' large urban centres do. Lancashire's geography is also a challenge, rural, coastal, with more distributed urban build-ups. This means it can fall in the cracks in terms of big initiatives like City of Culture. Much of the challenge can be of a geography of the mind. Lancaster to Preston is a much quicker train journey than, say, to Euston to Finchley. But I had significant problems getting groups to travel from one to the other for vocal projects. And that's just as much as about imagined distance and as physical distance. That the landscape and physical infrastructure in Lancashire demand a different approach to, say, that of Greater Manchester. But when one looks at what we've been doing, it's possible to turn things on its head. We're not at a disadvantage if we think that actually we're leading in terms of thinking about not being centralized, top down, but acting as a network. The map that we've ended up producing looks strikingly like the visualization we made for the City of Culture bid of a distributed approach. What is decentralized is resilient. That's the lesson of network infrastructure. For meaningful creative health initiatives, the contact has to be as close to the actual people to be benefited as possible. Support this infrastructure, strengthening it only takes modest amounts of money. Ella referred to, £5,000. It's even amounts smaller than that are crucial in terms of grassroots infrastructure. But we now need to be doing this in significant multiples. But I also want to bang the drum for respecting the contribution that the map surfaces. It's a significant economic activity and a body of professional experience that deserves better recognition, including pay and conditions. And going on to the next slide is also working with Elaine. I feel like I've had a massive mindset shift and a huge penny drop that in terms of my background, what you might terms the cultural sector, needs a mindset shift. If we're really talking about health, we need to be talking about population levels. I'm really used to organising on a very localised level, about worrying about what 40 people are going to sing on Monday. But actually, what in terms of health sector coming to us, we're saying we need to be worrying about the 1.25 million people who are in Lancashire. But equally, there's a mindset change for health sector, moving from how you get people to where you are, all these things about signing up for appointments, but also meeting people where we are. This data surfaces a massive opportunity. Thousands of people we're in contact with now are meeting weekly. And there's an extraordinary opportunity to connect these groups to health-based initiatives. So if kind of going on to the next slide, it's important to say that in all the data and information that we've come across in terms of the Holding Our Breath report and the work with County of Song shows how everyone within choirs is very engaged in the health conversation, not just in groups that are health focused. So a typical quote that came out of Holding Breath is, so when groups came back again, being able to sing again together has lifted us up and improved our mental well-being. Music practitioners are well experienced in this field, that talking about people, new groups of young people joining groups, that saying they've come from a wider range of backgrounds and abilities, which has made music making back in the room more tricky and of a different quality. But it's also made the social and personal benefits of being in the group much more pronounced to the participants. That you're knocking at an open door here. And now here we have also another, yes, so going on to, it's another of our blank slides. We'll go past that. It's the kind of final kind of point is that can keep on, I've been asking myself, what does this map actually represent? What are these points represent? Yes, they're points about where people meet, but what these points really represent is an infrastructure of people, and an infrastructure of people that also participants trust and respect. I think that public health over the particularly during and post post-pandemic, if we can truly speak of being post-pandemic, has suffered an extraordinary knock of trust. The blank slide was one of Boris Johnson giving a quick cheers in Downing Street. To be able to do any kind of meaningful community health, we need to be working from a point of contact and point of trust. These points on the map don't just represent a physical infrastructure. They are this infrastructure of incredibly skilled music practitioners, people like Charlie, that of committees who day in, day out have very deep connections with their communities, of the people making the brews who are constantly having real conversations with people on the ground. It's not just the musical work, it is that infrastructure of supportive community trust that is so valuable. And I look forward to helping to continue to support, and thank you so much to everyone who's been part of that. We'll be able to share the links to the singing map, and that's there for everybody for use. It doesn't belong to County of Song. That data is for all of us, for all of you. may we go on with the hearts full of song.
We'll put the link in the chat so you can see there, but when you click onto the actual choir, it gives you the information and details, dates, times they're meeting, who to contact, so you can join. So we did that really to really encourage more people. Loz, just a quick question around capacity. So do the choirs that we've listed here in this map, do they have capacity for more people to join? Certainly I know on Sunday when we saw the Blackburn's youth choir, they were certainly saying we have capacity, we want more people to join us. So is that the case across the board, would you say?
Yes, yeah, absolutely. I mean, thankfully, I was very concerned in 2022. It was because also what groups were telling us was quite concerning, and that I think we're in a more resilient place now, thankfully, even just two years later. But yes, still most groups are looking to recruit, particularly within the youth areas. Obviously, there is a natural progression onwards. Also, and my best advice is that there's plenty of contact information there. Do just also consult with the individual groups. Everyone's very welcoming and is also happy to have a conversation, but also perhaps about you or people you know and your specific needs as well.
Yeah, and when you were talking about the gaps, one of the gaps that we've highlighted just recently, just because we've been doing some work with refugees and asylum seekers, is that we don't have a refugee and asylum seeker choir in Lancashire and South Cumbria. So our closest one, as you very kindly informed me, is Manchester, I think. Is that right?
Yes, there's the West Choir in Manchester, and that I've done some work along with an organisation called Near Neighbours in Blackburn, who's supported work, and that's also been supported by More Music and the Festival of Making previously. But I was with a lot of these initiatives. It's always about it's about the things that were also highlighted in Anna's presentation. It's about with an eye to longevity and how and also how we can move beyond those things where we have a pot of funding which is two years, and then also we need, and then how do we think beyond that perspective, which is also I think what we're trying to encourage with County of Song.
Yeah. And Ellie and Loz, are you happy for us to open it up now for questions from people? Now, please feel free to unmute. Is that possible, Alexis, for people to unmute and ask a question, or do we want
they should be able to unmute themselves. They can also raise their hands using the little raise their hand button if they want to.
Wonderful. Or please, if you don't want to do either of those, you can pop a question in the chat. So yeah, if anyone's got any questions, please let us know. So Kirsty, I see you've got a hand raised.
Hello, can you hear me okay?
We can hear you, yeah.
Lovely, thank you. A question to Eleanor, if that's okay. I just wondered, I missed the very beginning of this meeting, I'm sorry, so I don't know whether you covered this already. Your warm-ups and songs and repertoire, are they tailored specifically to improve lung health, or do you just let the songs themselves do the work?
Hi there, Kirsty. The best person to speak about this is Charlie Brown, who does the choir. So my role is just bringing people together and looking at the funding and just coming up with a bit of the idea to try and get it off the ground from a health. So Charlie, would you be able to help with that?
Hiya. Can you hear me okay?
Yep.
Oh, super. Yeah, most of the songs and repertoire and warm-up exercises are tailored specifically for that purpose. Myself and 3 other kind of local practitioners have all been trained through the Musical Breath, which is a national opportunity organisation that kind of takes people that are already experienced in community choir or music or choir work, and then tailors their kind of background and knowledge specifically for this reason. So it's all quite specific. quite specific.
Brilliant, thank you.
Yeah, I'm going to go to Jens. Hi, Jens. Lovely to see you.
Hi. How are you?
I'm great. How are you? So, yeah, we got a question?
Yeah, so I put this in chat earlier, but I can read it out. So, can you comment on any work being done to integrate practitioner care into these projects? Because practitioners are often exposed to vicarious trauma through their work with clients, but they're not often undertaking the kind of supervision a creative arts therapist would. So I'm a visual arts practitioner and person-centered creative arts practitioner. So I've got counselling training as well alongside my arts practice. And I rely on that a great deal. I've also got like peer support groups that I'm part of that are more counselling peer support groups than art practitioner groups. But there is a person-centered organisation that I'm a member of, which is to do only with visual arts rather than music or expressive arts.
It's a really interesting question, Jens, and it's something that we have discussed actually. It's something that Loz has highlighted that, and I think you sort of you kind of spoke about it briefly in your presentation, Loz. You talked about how a lot of the choir leaders, particularly with the youth choirs, are finding that they are having to have these additional skills around to manage the well-being of the people in the group. Yeah, have you got more experience of that, Loz and Ellie?
Sorry, yes, I'm still at that. So yeah, absolutely. I mean, I think this is one of the things why looking at also what is the kind of the broader support that needs to be there. So that because there is a kind of significant difference between kind of projects which have a kind of a broader support. So Breath of Fresh Air is example one. So, but also, for example, Seagull Cafe in More Music, or the kind of work they're doing in Lytham, which is also requires that the needs of kind of bigger support around that, and also investment in that, so that for example, More Music, there is in terms of that kind of network set up. I think what's interesting is once you start to also surface a lot of these groups who also perhaps are not thinking along the lines that you describe, but then suddenly come across some very real issues, and also some very real responsibilities to take seriously. It's also that in fact won't have been quite alive to that, and I think that's it's another kind of gap and lack. But because there are plenty of groups perhaps operating in this sphere, but actually from also with perhaps mostly powered by goodwill, and it's about what we can set up, not to take away from that initiative, because that's actually that goodwill is all, but also in terms of also the safety of also practitioners concerned as well. I think that's really important about how do we support that, and that's protection where also that's being able to bring in something more overarching, but there are models out there, but just again, how do we scale that up?
Yeah, we've got a great question here. I don't know if I or the panel could answer this, but it's probably something that a national organisation perhaps needs to consider. But a great question around longer term, because could this work lead to a national repository to link us all and partner us with the NHS countrywide? I think that's a great suggestion. But as always, one of the big difficulties once the mapping's done is who owns and maintains that data. I think we've spoken about how mapping is consistently done And also, as Loz has found out during his presentation became out of date as you wrote it. So yeah, I think that's a great suggestion, and it's something that I'll probably take back to the National Centre for Creative Health team and kind of share it with them. Also, there are some websites, which is where I pulled a lot of the data to share when we were working together on the mapping. There is a couple of national websites for community choirs and community singing groups.
I think it's quite because what I'm trying to do now is linking in with our integrated care community level. We get our integrated care community development lead it's like a deep dive into the data we have regarding our respective wards across Lancashire or Lancaster area, Morecambe area. And for me, it's about putting in creative health opportunities where there's need. You know, if you've got sort of an area where there's a high prevalence of childhood asthma, can we do something around that? You know, for example, so an isolation equally, and all these other sorts. So I think there's creating infrastructure, but looking at from a flow of being creative, but also not just putting something everywhere for the sake of it. If you're working with health and aligned with health, I think there's great potential with that to work, and also to have some kind of support structure right across the creative arts and merging of health. I mean, I was looking at English National Opera and their Breathe programme. It's fantastic, you know, and there's online resource too. But do a lot of people know about them resources? So I think about having a repository of resource where there's things online, so people that might have fear of you know, going outside and or inability to get out and about through disabilities or other means or access. So I think there's real potential to try and map that in some way nationally would be great, and get this definitely going. I mean, you just said refugee and asylum seeker. I'm thinking already this could be great. You know, we had a festival of culture at Lancashire University only last year, I think it was, and it brought that cultural sort of flavour from the refugee and asylum seekers through poetry, through movement, through dance, their storytelling narratives. And I think it's a really great opportunity to look at some of their experience to create more empathy and understanding, and to break down stigma, you know, as well, which is, it happens, you know. And I think we need that to build a more caring and kind communities, to have something like that, I would say, where people have a voice. So yeah.
No, absolutely. And the other thing that I think we found really useful by just having that map, having it so visible, was it supported funding bids. So you can actually evidence where the gaps are. You can talk about the fantastic work that's currently taking place, but you can also talk about the need, and it's visual, it's there, isn't it? You can see, you know, you can visually see where the gaps are as well in areas. And it was also really helpful for checking the data, because I think once it got uploaded into my Google Maps, I suddenly went, hang on a minute, there's nothing going on in Morecambe. We know there's stuff going on in Morecambe. So it kind of highlights, what the data that's missing, where the gaps are.
Yes, it's very concrete. I mean, I think there's a lot to be done in terms of a kind of bringing together some kind of cultural understandings between sectors. As also, I feel like I've been on a massive learning cliff, which is great, but just in terms of how perhaps sectors which have different approaches can meet each other, but it's already practically bearing fruit. Is that already, in terms of where we're working alongside UCLAN and the NHS ICB with an intern working with a specific focus on singing in relation to case studies relating to music making in relation to dementia. So it allows for things to happen and allows for those meetings to take place.
Yeah, absolutely. I'm going to pop my email in the chat there. I think there's been some really lovely comments that have come through from the group. I know there's lots of experts out there in our audience today. I've popped my email there. We're going to be running these webinars hopefully monthly. So please, if there's something that you want to a topic that you'd like to look at further, please do share that with me and we can explore it. So I suppose I'm going to bring this to a close now. If anyone's got any burning questions in the last 2 minutes, I'll take that as, yeah, okay. I just want to thank you again, Loz and Ellie. Thank you so much for sharing the work, the great work that you do. And thank you so much to the National Centre, Alexis, for supporting us through